Hello, how are you? It has been a long time since I have seen you.
I am a little worried today. My nurse practitioner told me that I am at higher risk for diabetes because I am overweight. I am ready to make some positive changes. I would like a visit with a registered dietitian so I can get started losing weight and prevent diabetes. I hear they can really help people understand how to eat to lose weight and to still enjoy some of the foods they love.
That sounds like a great idea. Do you already have an appointment?
Unfortunately, I will be responsible for the full cost of the visit. My insurance does not cover nutrition visits for people without diabetes.
What? That is ridiculous. I have heard a dietitian visit could be up to $100 to $200 each hour.
I don't have that kind of money. Why will my insurance not cover this service?
If you actually had diabetes, Medicare will cover up to 10 hours every year for diabetes self-management education with a registered dietitian.
You mean that taking action to prevent a disease is not covered, but actually treating a disease is covered? That seems pretty counterintuitive.
Insurance companies like to focus on illness, not health. If you develop diabetes, I wonder if they will cover your complications.
That is a great question. I have heard that insurance companies will drop you if you develop a disease. You would think they would want to help people stay healthy.
They are not going to spend any money to keep you healthy. I guess they think you need to take care of that yourself. If you get sick, they may just drop you because you cost too much money to cover.
This seems like a lose-lose situation. I have learned some bad things about diabetes in the past few days.
Yes, my husband's brother has diabetes. It can be pretty devastating.
Did you know that diabetes is one of the leading chronic diseases in the United States? There are nearly 20 million people with diabetes in this country, and another 79 million who are at an increased risk of developing the illness. Most of these people, about 95%, have type 2 diabetes, which is largely preventable with a healthy lifestyle. Our healthcare system does not do a good job of promoting wellness. We need some serious changes in healthcare policy to shift the focus away from sickness toward prevention and health.
Yes, I have heard that diabetes can lead to blindness, kidney failure, and leg amputation. People with diabetes are at higher risk of heart attack, stroke, and poor circulation. In fact, more than 2/3 of people with diabetes will die from a heart attack or stroke.
Sadly, most of these deaths and illnesses would be preventable. Obesity is the single largest risk factor for the development of diabetes and many other illnesses, and the rate of obesity has skyrocketed in the U.S. Obesity-related diseases are now responsible for more death and disability than smoking. Knowing that obesity causes multiple chronic diseases should cause healthcare policymakers to mandate coverage for obesity care.
The economic cost of diabetes is astounding. According to the American Diabetes Association, for each person with diabetes, about 11,500 healthcare dollars are spent. In fact, 20% of healthcare spending is directly related to diabetes. We spend nearly $220 billion every year just for caring for diabetes. That includes lost productivity related to disability.
A major research study found that people who engage in modest weight loss, and I am talking about 7% of their body weight, develop diabetes at much lower rates than people who did not lose weight. A 7% weight loss would be about 21 pounds for a 300-pound person. This is not a lot of weight. People who were offered the support of a registered dietitian to help with meal planning and promote exercise were successful in weight loss. This is not a costly intervention.
Dialysis is a costly intervention. 44% of new cases of end-stage kidney disease are due to diabetes. The average annual cost for one patient receiving dialysis is $30,000. Multiply that by the over 45,000 Americans per year who start dialysis and the figure is in the hundreds of billions.
Medicare tends to be the pace setter for all insurers. Medicare only covers nutrition therapy for patients who already have diabetes or kidney failure. Other insurance plans tend to cover what Medicare does, and to reimburse at similar rates. For example, Medicaid does not cover nutrition therapy for obesity, only for diabetes, breastfeeding, and other conditions that meet medical necessity criteria.
When are we going to wake up and embrace prevention? I do not think mandating coverage for obesity or nutrition services for those at risk for diabetes will solve all of the chronic illness. It is just too overwhelming. Nor do I think anything is going to fix the healthcare crisis overnight. We have a long road ahead. But I do think that we should support people who have made the decision to get healthier. They should be able to afford their preventative services. Even if a few cases of diabetes were prevented annually, the cost savings could be tremendous.
As healthcare reform is on everyone's mind, we need to advocate for coverage for diabetes prevention for people with obesity. The evidence is there. Preventing diabetes works when physical activity and a healthy diet combine to promote modest weight loss. We need to contact our legislators and demand that they mandate coverage for preventative services like nutrition therapy for people at risk for diabetes, like me. They need to know that real people are suffering and that we could all be healthier if we had access to prevention.
You have inspired me. I am going to write my congressman right now and let him know that I support diabetes prevention. You should, too.